Welcome to Module 1 of the UCSF Champion Provider Fellowship Training. This is the first of 3 training modules in the series. Each training module consists of a brief video presentation, a worksheet that you will work through on your own, and a brief comprehension quiz. To complete each module, you must complete each of the 3 items. The goal of this training series is to enable champion providers to understand policy, system, and environmental change, also known as PSE change, describe the 7 key elements of policy, system, and environmental change, and how they can be put into action. Understand how providers have been able to successfully engage in policy, systems, and environmental change, and discern the difference between advocacy and lobbying and the rules that apply to champion provider fellows. In this first training module, we will focus on providing an overview of policy, systems, and environmental change, or PSE change, and an introduction to the 5 focus areas of the fellowship: healthy food and beverage standards, food security, school wellness, safe routes to school, and structured physical activity. Here is the agenda for Module 1. We'll introduce PSE change, then do a deep dive into policy. We'll highlight some of the roles providers can take in PSE change, and we'll provide an overview of the 5 PSE change topic areas that are the focus of this fellowship. Before we begin, pre-reading for this module consists of reading and reviewing the Champion Provider Fellowship PSE Playbook, implementing policy, system, and environmental change in our communities. Additionally, you will need a piece of scratch paper and a writing utensil. If you have not already completed your pre-reading, or you need to get a paper and a writing utensil, please pause this video and complete that now. If you are ready to move on, let's continue. So let's jump in. In this first section, we will introduce the concept of policy, system, and environmental change, and highlight why we focus on these types of interventions to promote health in this fellowship. We'll also provide a practical example of PSE change in action. You can find a section dedicated to explaining the basics of policy, system, and environmental change in the PSE playbook starting on page 3. So first, what is policy, system, and environmental change, or PSE change? On the slide are the formal definitions of policy, system, and environmental change. We're going to spend a fair amount of time on this, so we're just laying the foundation here with these formal definitions. A policy change is the creation or alteration of a formal written statement of a government, business, or nonprofit that results in a new organizational position, decision, action, or mandatory rule or regulation. A system change is an informal and ongoing change in organizational practices and procedures that results in a new, voluntary way of doing business. And an environmental change is one that directly alters the physical, economic, social, or messaging environment that results in a new level of access or opportunity for the target population. Now, you may be wondering to yourself, why focus on policy, system, and environmental changes to improve health? PSE changes are designed to focus on upstream causes of poor health. When we say upstream, we mean broad societal conditions that may impact a patient or a community's health. Things like how easy it is for someone to access nutritious food. Conversely, downstream changes focus on the immediate causes of poor health, like a patient's medication management or the amount that they exercise. As a physician, your efforts probably focus more on these downstream changes by providing direct clinical services that help people live healthier lives. However, in this fellowship, the focus on policy, systems, and environmental change is meant to complement that downstream effort with changes that address the upstream or root causes of poor health. Now, why is it important to work on policies, systems, and environmental change to address the upstream causes of poor health? There are many reasons. First, it is important to understand that there are broad social, economic, political, and environmental conditions that impact our health outcomes. This ranges from individual factors like age or genetics, what we eat or how much we exercise, to larger social, economic, and political drivers. All these factors impact our health simultaneously and at different scales and to different degrees. Stated another way, where we live, the conditions of our neighborhoods, parks, schools, and roadways, and access to quality schools, healthy foods, resources, and services are important drivers of our health. Research has shown that about half of our health outcomes can be attributed to physical, social, and economic factors, such as how walkable our streets are, how safe our neighborhoods are for playing and recreation, and the quality of food available. For this reason, focusing on upstream change is an effective way to impact some of the largest drivers of our health. The Health Impact Pyramid describes the impact of different types of public health interventions and their effectiveness for improving health. At the base of this pyramid, you will see interventions with the greatest potential impact, in this case, socioeconomic factors. As you make your way to the top of the pyramid, you will see that individual effort increases while the population impact of the health intervention decreases. Interventions focusing on lower levels of the pyramid tend to be more effective because they reach broader segments of society and require less individual effort. Implementing interventions at each of the levels can achieve the maximum possible sustained public health benefit. Therefore, in this fellowship, our focus on policy, systems, and environmental change is meant to complement direct clinical interventions to achieve greater public health benefit. We also know that it is far easier and more cost-effective to prevent illness and disease rather than treat it once it happens. For every $1 spent on community-based prevention programs to increase physical activity and good nutrition, and to prevent smoking and other tobacco use, the return on investment is over $5. However, not enough attention and resources are dedicated towards prevention, even though we know that preventable factors such as behaviors, physical environments, and social economic drivers are the primary determinants of our health. Only 4% of our overall national health expenditures are spent on prevention measures. There is a great opportunity for providers in this fellowship to support prevention through policy, systems, and environmental change by focusing on upstream changes to address health. While educational programs and clinical services are important to engage people in improving health, policy, systems, and environmental change can allow you to reach a much larger population and create a lasting impact on health. By thinking beyond an individual's or a program cohort's conditions, you as a provider can create a healthy community. You can help residents of all ages have the opportunities and resources to lead a nourishing life. You can help create a better environment to live, work, and play. To wrap up this distinction between upstream and downstream changes to health and to solidify why this fellowship is focused on policy, systems, and environmental change, let's talk through an example. Imagine as a provider, you see a child in the clinic who is at high risk for diabetes. Your recommendation may be to have them spend more time playing outside, walking to school, getting more overall physical exercise, and eating more fruits and vegetables. These are all behavioral choices and activities that will likely help this young patient be healthier. However, you see young patient after young patient with the same risk factors from the same community. No matter how many times you say it, how adamantly you may urge them to get more exercise and to eat healthier, they show no progress toward reducing their risk. What can a provider do? Let's say you happen to walk or drive through the neighborhood where many of those young patients live, and you see the conditions of their neighborhood: uneven sidewalks, shuttered recreation centers, empty parks that lack basic amenities, very few crosswalks, and oversaturation of fast food restaurants. It's no wonder they failed to heed your advice. Where would they play? How would they walk to school safely? Where would they get fresh fruits and vegetables? It may feel odd to consider fixing sidewalks and adding crosswalks as a tool for preventing and addressing diabetes. But by working to change the upstream factors that are inhibiting young patients from eating better, walking to school, and playing outside, providers can encourage the maximum possible sustained benefit for a community of patients. Policy systems and environmental changes, by design, focus on these upstream factors to promote community-wide benefit. Now that we know a little bit more about why we focus on policy systems and environmental change to address the upstream causes of health conditions, let's focus our attention on each of these components to understand how they can be used to improve community and patient health. To show the different ways policy system and environmental change can be used to address a community problem, let's walk through an example. An employee wants healthier choices to be stocked in vending machines at their workplace to increase healthy food options. As a first step, the employee might educate coworkers on the importance of healthy snacking to reduce consumption of unhealthy products from the vending machine. Education might initially decrease demand for unhealthy snacks, but to succeed as a solution, it would require ongoing coaching because its impact would be limited to the coworkers who had received the education. Although it is a crucial element in implementing behavioral change, education alone is not considered a policy, system, or environmental change. Nothing has been done to change the environment, system, or policy conditions to encourage the adoption of healthier choices. Now, let's walk through the first of our policy, system, and environmental changes. An environmental change to encourage healthy vending could involve removing the unhealthy items from the vending machine. By doing this, you are literally changing the environment of the vending machine by moving the unhealthy items out. Removing the unhealthy items would be one way to address this problem. They would no longer be accessible for people to purchase, thereby discouraging their consumption. The benefits of this change are that they take less time than other changes and usually need fewer resources to accomplish. However, what would prevent someone else, like a vendor or a coworker, from restocking the unhealthy items once they realize they're nowhere to be found? This change can be quickly reversed and often is not self-sustaining. Environmental changes often need monitoring and maintenance to ensure that they remain in place. A system change would be to ask the distributor to only stock healthy items in the vending machine. The employee would work with existing or new vending machine operators to change to a healthier product mix. In this solution, the vending machine's system operators, the distributors, would change their procedures for stocking the machines. If the changes in their processes remain in place, this system change could encourage healthier snacking for quite a while. Through this change, you have altered the products that are being stocked in the machine. There is less need for continuously monitoring what's in the vending machine because you've made changes to the system, in this case the distributor, that stocks healthier items in the machine. System changes alter the way business is conducted and impacts all elements of that system. However, company management may change, which could lead to a disruption of this system. A new distributor may not be aware of your request and could go back to stocking unhealthy items. In a policy change approach, the employee works to adopt a policy requiring that a minimum percentage of foods sold in vending machines on company property meet nutritional standards. This policy would be a written statement, which would be binding and would be applied widely to all company vending machines. This policy could endure changes in management, operators, or distributors and would provide sustainability. A policy change may seem like the most appealing option, but policy change takes time and a considerable amount of effort to achieve. Key decision makers need to buy into the idea. Implementation of the policy directive, in this case nutritional requirements for food and vending machines, would require active monitoring systems. And policy is not guaranteed indefinitely. New management could change the policy or fail to enforce it. In this example, each type of PSE change listed would achieve the goal set by the employee: healthier food and vending machines and improved nutritional options at the workplace. No one change is necessarily better than another, and each type has benefits and considerations. Successful change often combines elements of each type or uses elements that blur the lines between the PSE categories. Now that we have walked through the basics of PSE change, let's spend some time exploring policy changes in more depth. Policy work has several advantages, some of which we've identified already. So let's take a closer look. Here's the definition again: a written statement of an organizational position, decision, or course of action. Ideally, policies describe actions, resources, implementation, evaluation, and enforcement. Policies are made in the public, nonprofit, and business sectors. It's important to note that policy is more than just legislation. The bill sitting on Capitol Hill from Schoolhouse Rock is certainly a policy, but policy comes in many other forms too. It is easier to define policy through examples than through a dictionary definition. Everything from local ordinances to contracts can be policies. The characteristics that these have in common are that they are written down and they establish rules or principles to be applied broadly. Not all policies are equal in terms of effectiveness or strength. Policy comes in different forms, but in their strongest form, they have three important things in common. They are written down, they are binding in some way, and they set out a general approach to be applied widely. What are the benefits of strong policy? First, strong policy offers accountability and enforcement. For example, most policies include some sort of penalty for not following them. In a law, that could be a fine or a citation. In a contract, it could mean the loss of some other benefit, like payment. Second, because strong policies are required and not voluntary, they reach more people. Take healthy checkout aisles in grocery stores. You might have heard of this idea. It's where a retail store only offers items in their checkout aisles that meet certain healthy criteria. This is a change that many stores have done voluntarily. This is great and certainly constitutes an environmental change, or maybe even a policy or systems change for that individual store. But it only reaches people who shop in that store. Now, some chains are making it part of a corporate system change. This has a broader reach. Individual stores that are part of the retail chain are required to have a healthy checkout aisle, and the system change reaches more people as a result. But businesses can change their mind. What if then a city or even a state required all stores meeting certain criteria to have at least one healthy checkout aisle? You get the picture. That would obviously reach many more people and consequently have a much wider reaching effect. And finally, policy institutionalizes good ideas. Think about things like seatbelt requirements and tobacco control laws. Two good ideas, always wearing seatbelts and not smoking, are now much more common because of changes in policy over the years. Now that we have walked through the basics of policy, system, and environmental change, and we have looked at some of the reasons why people focus on policy, let's do a little knowledge check. As a knowledge check activity, I am now going to go through some examples of PSE changes. On a piece of scratch paper, write down whether you think the example is a policy, system, or environmental change. I'll give you a few seconds to get ready. A local county government formally writes and implements a plan to only supply fruits and vegetables as snacks in its youth serving programs. The answer to this example is policy. The change that you want to see is instituted across the entire county, so it doesn't matter which program youth go to, they'll see the same change across all programs. And it is a formal plan that's written down. A local community organization asks retailers near schools to voluntarily remove sugary drink ads from their store windows. The answer to this example is environment. These stores are changing their space, but there's nothing to stop those ads from going back up again. Providing food bank participants educational materials about cooking healthier items. This is kind of a tricky one. It's not a PSE change at all. Although education is an important step in any intervention, it is not considered a PSE change. A school principal decides to stop purchasing sugary drinks using school budget funds. The answer to this example is system. It is an ongoing decision in an organization that results in a change that reaches a lot of people. So, how did you do? You may have noticed from the examples that policy systems and environmental changes are not always siloed processes. There is a lot of overlap and synergy between these strategies. For example, a policy can lead to an environmental change or trigger a system change. Environmental changes can be made more sustainable through a policy change or a system change. Think back to the earlier example of the workplace vending machine. Changes to the vending operating procedures, a systems change, supported a change to the environment. No more unhealthy items in the machines. PSE change is not stagnant and can often have other effects that stem from them. For the rest of the modules, let's keep this in mind. However, to help set a plan for action in your work for the fellowship, providers should be as specific as possible about which type of policy, system, or environmental change you would like to focus your work on. Picking one of the 3 types of changes as your focus is important for implementation planning and clarity in goal setting for this fellowship. You will have time to work on identifying your focus in the Module 1 worksheet that accompanies this training video. To review, PSE stands for Policy, System, and Environmental Change. Policy change is generally more complex and can be more time-consuming to accomplish than a system or environmental change. Policies encompass much more than just legislation. Often, system and environmental changes build toward a policy change, but they can also be implemented on their own to promote health. PSE change is not always cut and dry, and each of the different changes can affect each other and often work together to promote change. There is no one right way for fellows to get involved in PSE efforts. Both physicians and local health departments are valuable partners because of their health expertise, experience with at-risk populations, and role as respected members of their communities. Both can play many roles with varying levels of involvement to support PSE change. There are no set roles for work in PSE change. However, it is helpful to have some structure so you can see where you fit into the work. The Champion Provider Fellowship Playbook provides an overview of the roles that providers can play in implementing PSE work. This can be found on page 8 of the playbook. On the left of this chart, you see several roles that providers can play: connector, advocate, amplifier, team expert, and leader. On the right, we indicate the level of involvement for each role. A low level of involvement indicates a one-time role that requires a limited time commitment and is not central to the implementation or sustainability of the intervention. An example would be testifying at a public meeting. A medium level of involvement indicates an ad hoc role that requires a moderate time commitment and is not central to the implementation or sustainability of the intervention. An example would be attending 3 task force meetings to help design a policy. A high level of involvement indicates an ongoing role that requires a significant time commitment and is central to the implementation or sustainability of the intervention. An example would be securing funding for and helping to design and manage an ongoing physical activity program. I am going to walk through each of these roles to demonstrate what they look like in practice. A connector identifies other providers in the community to augment support for an issue. This is a low commitment role, but an incredibly valuable one in creating PSE change. A person serving this role would be a good networker who is able to identify shared needs across different groups. For example, a provider in this role would pass along contact information of the change implementers to interested parties, educate other people on the importance of the change, and gather support. An advocate advocates for a specific policy, decision, or change. This role is also low commitment. A person serving this role would be actively encouraging people to support the change. Unlike the connector, who is educating and connecting interested parties, an advocate is proactively gathering support for the change through petitions or community meetings. This could also involve attending meetings with decision makers to gather support for the change or participating in interviews with media outlets to educate the public. An amplifier writes, speaks, blogs, or is interviewed about an issue. This role is a medium commitment. A person serving this role would be meeting with decision makers to gather support for the PSE change or participating in interviews with media outlets to educate the public on the PSE change. An expert joins an existing collaboration or partnership or provides subject matter expertise. This role is medium commitment. A person serving this role would join a coalition and serve in an active role. They would be a champion of the change and could get involved in advocacy, connecting, and amplification of the issue. A leader identifies or produces resources, convenes stakeholders, or establishes multi-sectoral partnerships. This role is a high commitment. A leader would play a consistent, active role in bringing about the change and would support its implementation and sustainability. Local health departments are often a strong fit for this role because of their connection to resources, funding streams, and the community. The roles provided here are just ideas for how providers can get involved in policy, systems, and environmental change work. If you only have a very limited amount of time, there is still a valuable role you can play. These roles provide guidelines, but they're not set in stone. Find what works for you as you start to do the work. In the Champion Provider Fellowship, there are 5 topic areas we ask our fellows to focus on. We will spend the final section of this module going over those topic areas. More information on the 5 topic areas can be found on page 19 of the PSE Playbook. The 5 topic areas in the Champion Provider Fellowship are healthy food and beverage standards, food security, school wellness, safe routes to school, and structured physical activity. We'll walk through each of the 5 topic areas and provide examples of policy, system, and environmental changes fellows can work on in each of those areas. On each of the examples, you will see an orange circle labeled with a P, S, or E to indicate whether the example has a policy, system, or environmental change focus. The first topic is healthy food and beverage standards. These standards define the types of foods and beverages that are available and the way they are promoted in stores, restaurants, schools, workplaces, healthcare settings, and other places where community members can access or purchase food. More information on the healthy food and beverage standards can be found on page 19 of the PSE Playbook. Here are some examples of PSE interventions that create healthy food and beverage standards. Adopt a municipal policy requiring food stores to place healthy items instead of unhealthy items near the checkout counter. Implement a healthy corner store program incentivizing small food stores to stock and sell healthier foods while limiting the promotion of unhealthy items. Adopt a municipal policy requiring food stores to stock a minimum amount and variety of specific healthy foods. The second topic is food security, which refers to the consistent availability and usability of affordable, nutritious food among at-risk communities. More information on food security can be found on page 25 of the PSE Playbook. Here are some examples of PSE change focused on increasing food security in a community. Adopt a payment policy at a local farmers market that allows SNAP participants to purchase produce with their SNAP benefits. Implement a voluntary donation program to distribute surplus food from stores, restaurants, farmers markets, and farms to food banks. Develop a community garden program enabling residents to voluntarily learn about, grow, and eat fresh produce. The third topic is school wellness, which refers to any effort to improve a school's food or physical activity environment above and beyond those changes required by federal law. Federal law requires schools participating in the National School Lunch Program and other child nutrition programs to adopt a local school wellness policy. These policies include standards requiring healthy foods and beverages in cafeterias and limiting the sale of unhealthy foods and beverages in vending machines. This law applies to most public schools. More information on school wellness can be found on page 31 of the PSE Playbook. Here are some examples of PSE change focused on school wellness. Adopt a healthy vending policy prohibiting sugary beverages and candy from being sold at after-school events. Change the recess schedule to increase the amount of time available for students to be physically active during the day. Redesign a school cafeteria, including the display and placement of lunch food, to promote healthy choices in alignment with recommendations from the Smarter Lunchrooms movement. The fourth topic is Safe Routes to School, which refers to any effort making it safer and more convenient, accessible, and affordable for students and their families to walk, bike, or take public transit to school. This definition is based on the National Safe Routes to School program, which encourages active transportation, such as walking and biking, as a form of exercise and supports bicyclist and pedestrian safety between home and school. More information on Safe Routes to School can be found on page 41 of the PSE Playbook. Here are some examples of PSE change focused on safe routes to school. Adopt a transit agency policy that funds free or reduced cost bus passes for low-income students. Create remote drop-off locations where students can voluntarily be dropped off by bus or car and safely walk the remainder of the way to school, increasing physical activity. Or implement a volunteer crossing guard program to provide assistance and supervision at crosswalks near schools before and after school hours to ensure that traffic yields to students. And the final topic is structured physical activity, which refers to convenient, planned, guided, and culturally appropriate recreational opportunities in community centers, schools, workplaces, healthcare settings, or other venues. Unstructured physical activity, by contrast, refers to unplanned activity, such as playing games at recess. More information on structured physical activity can be found on page 47 of the PSE Playbook. Here are some examples of PSE change focused on structured physical activity. Adopt an open use, shared use, or facilities use agreement, making school facilities available for structured physical activity. Create a hospital-based physical activity program offering voluntary dance and yoga classes for patients and staff on hospital grounds. Adopt a municipal policy converting vacant land or underutilized parking lots into public open spaces. To review, we covered examples of policy, system, and environmental changes in 5 topic areas: healthy food and beverage standards, food security, school wellness, safe routes to school, and structured physical activity. As you can see in the examples provided, policy, system, and environmental changes often work together. Many of the examples provided featured 2 of these changes happening simultaneously. In summary, here are key points to keep in mind. PSE refers to policy, systems, and environmental change. Policy is more than just legislation. Providers can play several roles in PSE change. And finally, sustainable change is possible. Just look at what has been done across all 5 topic areas. Thank you for watching Module 1. This is the first of 3 modules in the series. As a reminder, much of the information covered in this module can be found in the PSE Playbook. To complete this module, please return to the landing page and download the worksheet and quiz that correspond to Module 1. Please complete the worksheet and the comprehension quiz before beginning Module 2. Thank you for listening.